Hi, welcome back to my channel. Today I am doing a part 2 to the dental nurse confessions video I put up a couple of weeks ago. If you haven't seen it and you don't know what I'm talking about, then go check it out just up here. I'll put it in the clickable I button for you. Basically, it's just me going through a page on Instagram called Confessions of a Dental Nurse. They've also got a page on Facebook, and I'm just choosing any at random and kind of reacting to it, I guess, and maybe telling you a story about an experience that's happened to me. It's just a lot of funny things about dental nursing and dentistry. Anyway, if you want to see the part 2 to this video, then just keep watching. So I've got the page up here and I'm just going to start picking them out at random. When you have not even started the treatment yet and your patient is already dangerous. Okay, do you know what? This happened to me the other day. So some people I can completely understand, they are nervous, but other people take it way too far. So we did have this woman in, and when you're in a dental chair you need to be backwards because the dentist can't bend over in such a way so he can see your mouth when you're sat straight up. So you need to be lying backwards with your head up. Anyway, so he started putting the chair back and she's like,
"What are you doing?"
And she's like, "I'm just putting the chair back."
Well, can you stop there?
And she's only like here at this point. And he's like, "I need to put you back a bit further just so I can see in your mouth." So he literally like taps the button and she's like,
"Stop!"
So we know it's going to be a difficult patient from that one because we're going to have to bend a lot to be able to see into this mouth. Anyway, he says, "Right, I'm going to put the chair down now, so it's not going to go backwards anymore, it's just going to go down." She's like,
"What do you mean?"
She was so jumped. Before we even did anything, before we even touched her, she literally just sat in the chair. I understand patients are nervous, but it does make you want to just go, "My God, pull yourself together." However Edna speaks. Edna Maud. But yeah, definitely true. And if you're a really nervous patient, I'm really sorry. Sorry, not sorry. The patient swears they use TP brushes daily but can't remember which colour they use and their gums. Yep, definitely. So TP brushes are like the little floss sticks that go in between your teeth, and the amount of patients that we have, and they're like, "Yes, I floss daily," but their gums are all bleeding. Your gums won't bleed if you floss every day. Even if you floss every other day, your gums won't bleed because you've gotten all the stuff out of them. The reason they bleed is because there's so much clogged up in the gums. So when you use TP, then you're unclogging all of that, and there's obviously going to be like blood and stuff under it, so then that all is going to come out. Everybody thinks when your gums bleed, it's a bad thing. It's not. Like all the adverts on telly, and it's like, if you brush your teeth and you bleed, it could be a sign that you're losing your teeth. But not until about 20 or 30 years time. If your gums bleed, then it means you've actually brushed them better than what you normally would, because you're unclogging all the crap that's stuck in there. So don't be put off if your gums bleed. Brush them more if they bleed to get rid of all the stuff. And definitely bullshit everywhere when the patient says they use TP brushes but they can't remember which colour and their gums are completely just inflamed and red and swollen. They don't floss. Opening tooth pot be like, yeah, for any of you out there that is also a dental nurse, you will completely understand this. The tooth pot is a pot which all of the teeth go in that have, well, you've got two separate pots. So you've got the amalgam waste pot, which is where any waste amalgam goes, the stuff you haven't used from a filling, but also where teeth go when you take them out with amalgam fillings in, that has to go into the amalgam waste pot. And there's also, some practices don't have it. If you don't, they just go in the sharps box, but some practices have a tooth pot where all the extracted teeth go. Stinks. And every time, oh, basically when I have to open it, I have to turn it away from me, open it like this so I can't see anything because it's so disgusting what's in there. Imagine 20 or 30 teeth, all from different people. Some of them are completely rotten, some of them have abscesses on. They're gross. It's a disgusting pot. I always have to wear something over my face, just like Patrick. I don't usually scratch my face, but when I do, I'm wearing surgical gloves. This is so annoying. So every time I get like an itchy head or something, I'm always wearing dirty gloves. It's just something that your body wants to annoy you with, and you can't scratch anywhere with it because your gloves are dirty and it's gross and they've been in people's mouths, and you wouldn't want to touch your face if your hand's been in something disgusting, would you? Admittedly, not all mouths are disgusting, but just having your hand in somebody else's mouth is disgusting, or touching something that's been in their mouth is disgusting. Or, oh my god, the other day, right, bit off subject, but it's just reminding me of it. We had quite an old patient in, and I thought stuck on her cheek was like a bit of tooth that the dentist has drilled. It was food. Ugh! It was disgusting. It's like this chunk of white stuck on her cheek, and normally if you suck something hard up with the suction, not a euphemism, if you suction something up which is hard, you can hear it go through the suction because it like hits the side and it bounces off of it, and you can just hear that it's hard. But if you obviously suction something soft, then you can't hear it, and you know that it's soft because of the way it goes up the tube. I put it on the cheek and this thing went up the suction, and I was like, oh, that's a piece of food. It was minging. I don't know what it was. I don't know whether it was chicken or fish, but honestly, seeing food stuck in people's teeth, I know it happens to everybody, including me, because I eat, but why would you go to the dentist with all of that still on your teeth? It's just disgusting, and it was all stuck to her cheek, and it was disgusting. And these are the type of things that makes me want to gag in surgery, and I can't. But then they make me feel sick because I just can't stop thinking about them. And then I know if that's in her mouth, what the suction filter is going to be like at the end of the day. Oh, it doesn't bear thinking about. Anyway, I'm going to move on now because I've spent a long time on that one. Perio patient. This is basically what I was talking about with the TPs. Blood everywhere. Perio patients. Perio is where you've got gingivitis, which is gum infection, and gum infection is where they are very, very swollen, very red, and they bleed. And when you scale a perio patient, there literally is blood everywhere. Even just from one tooth is like a waterfall of blood. So imagine doing the whole mouth and every single tooth is bleeding, but not a little bit of blood, a lot of blood. I wear a visor, and sometimes it will land on my visor and then I just see it there. When you scale a perio patient, you may end up looking like this. My face when I see a dentist trying to mix. To be fair, they're not awful, but when you see a dentist try and do something that you are specifically trained to do, I guess, like mixing the alginate. Alginate is the stuff they take impressions with. And when you see a dentist try and do this, all the nurses will have their own techniques. They always say if you can mix cake batter, you can mix alginate. It doesn't really work because it doesn't feel anything the same, but anyway. So all the nurses will have a certain technique to mix that alginate. I have a certain technique to mix my alginate. And whenever I see the dentist do it, I'm like, it's not efficient. It's not quick, the water is not a good temperature, and it's going to set too quickly, and you are Mr. Bean, you're like, It's not the way I would have done it though. I can see that here. When your patient starts crying and you don't know what to say, are you okay? Yes. I know it's awful when patients cry, or like when anybody cries in general. I'm not very good at consoling people that are upset unless I'm really close to them. So if like my best friend is crying, I'm going to give them a hug and make sure they're okay, and I'll know what to do because they're my best friend. But if somebody I don't know very well is crying, I'm like, they're there. Or especially a patient who you really don't know unless you do actually know them. So when somebody comes in and if they start getting teary, I'm like, and obviously it must be harder for the dentist because all our dentists are male. You obviously do get female dentists, but all of our dentists are male, and you feel like you should be doing something because you're a woman. I know that sounds so sexist, but I feel like I should be doing more because I'm a woman and I'm just supposed to be better at dealing with that kind of stuff. But I have to leave it to the dentist because I just don't know what to do. Honestly, this shark is a very accurate representation of me just standing in the corner of the room like, that is true. I'm honestly there like, are you okay? I don't even say anything, I don't think. I just give them a tissue. Probably should be more professional about it, but I'm not good in those types of situations. So if you ever meet me, please don't cry. when you hand the dentist something before they ask for it. I did this twice yesterday. So I set up the surgery for a couple of fillings, and the dentist normally always gets the hand pieces out himself. One of the dentists does anyway. And I was like, oh, do you know what? I'm just going to get them out because there's no reason for me not to do it. It's just that he always does it himself. So anyway, I got them out, and not halfway through the treatment, but he numbed up and he opened the drawer, got 2 hand pieces out, opened them, went to put them on the little stick things that the hand pieces go on, and he was like, "You've done them." I'm like, "Yeah, I've done them. Should have done them anyway, but I've done them." They are shook. Or when you, so that's just an example of what I did yesterday. Hand pieces, I know we should be getting them out anyway, but this specific dentist always gets them out himself. So like say, for example, a lot of time they ask for floss in like crown fits, and sometimes I'll put a bit of floss on their tray already, and they go, "Can I have some floss please?" And you're like, and they turn around and they're like, "Where did that get there?" Then, well, I already knew we were gonna need it. So yeah, it just makes you feel smug, but not in like a really bad way. You just feel really smug as the nurse. You're like, I'm super organised, and most of the time the patient picks up on it and they're like, "You read his mind, didn't you?" I'm like, "Yes, I did." But yeah, that is kind of, they are shook. I don't really know if I would accurately describe it, but they are like shook. I feel really awkward because normally when I film there's background noise downstairs and it is dead silent, and I'm not in the house on my own, so I feel like people are just listening to me. Right, and I'll make the last one. Hopefully this is going to be a really funny one. If it's not, I'm sorry. That will be in the next video. Can't promise anything, but it should be in the next video. And the patient's determined that they're relaxing their tongue. Yes! So, okay, not really that funny, as you can tell by my reaction. As you can tell by my reaction, I could film this whole video like this. I'm not in the mood today, but I know I've got to get a video up tomorrow. So I'm trying to make it as energetic as possible because I'm out tomorrow all day. I'm going up to Portsmouth and I won't have time to film or edit, so I'm having to film and edit tonight. Anyway, that's going off subject. I'm trying my best to be enthusiastic about this. I'm really tired. I just got back from work and I had some dinner and I really want to go to sleep, but I can't. Anyway, back to this. So, when a patient is determined they are relaxing their tongue, this picture basically is saying patients' tongues, actually very similar to what was in the first video, they're like this. And the tongue is the strongest muscle in the body. So when I am putting the full force of my weight on your tongue to retract it, my suction tip is going to go like that because your tongue is so strong it's actually bending my plastic. Sounds dodgy, we'll avoid it. When your tongue is moving everywhere, my suction tip is going to go like that because I'm having to use so much of my weight, or not really my weight, well yes, my weight actually, I'm having to really force it back. Do you know what? Sometimes I feel like I've been to the gym when I've got a strong tongue patient. The tongue is so strong and you can't even feel it most of the time. If you've just got your mouth open, the chances are your tongue is in some way moving if you know that somebody's watching. If you just opened your mouth, it probably wouldn't move. When you know you've got something in there, your tongue automatically goes to it without you even realising. That's what it's like when you've got a drill and the suction, the patient's tongue goes to it and I'm like, something. Especially on the lower right hand side, the dentist retracts the cheek and drills and you have to retract the tongue and suction. Sometimes you can do this just with the suction, but sometimes you have to use a mirror. So your left hand is in there with a mirror, pulling the tongue back, your right hand is in there suctioning, and you're working like your muscles are almost shaking because you're trying so hard to retract this tongue. And then as soon as they relax their tongue, you end up going really quickly backwards and probably hurting them. Not being funny, I've probably hurt a fair few people in my time with a dental nurse because their tongues are so strong and then they just all of a sudden relax them and you've got so much force on it and you end up hitting them in the back of their throat or something. It does happen. So if that ever happens to you, it's because your tongue is working too hard against that suction or mirror retraction. I think I'm going to leave this video there for today. I'm really sorry it hasn't been like full my normal energy, but I also feel really awkward filming in dead silence when I know people are downstairs because they can probably hear me film this because my room is not soundproof whatsoever. Next time, I promise I will be a little bit more like bubbly and better and back to like my normal video self. I'm sorry this video hasn't been up to like proper standard, but I did want to get a video uploaded for you guys this weekend so that my next video next weekend I'll put, well hopefully I can put a little bit more time into, but I am working all week, Monday to Friday. I normally have a day off, but I don't this week, so it's gonna be hard. but I'm going to try my best. I'm going to stop waffling now as well. Anyway, I hope you guys, you see, I shouldn't be filming a video today. I hope you guys enjoyed this video. If you did, don't forget to give it a thumbs up. Click that subscribe button down below, and I'll see you in my next video. Bye, guys.